We're going to be looking at breast health, how to create optimal breast health. As many of you know, I have a family history of breast cancer, so this is of particular concern to me. And when you consider that 1 in 8 women in the United States are going to be diagnosed with breast cancer, we need to do everything that we can to create optimal breast health each and every day. What we're going to be looking at are ways to diagnose breast cancer, looking at mammograms versus thermography. We're going to be looking at tests for your breast to look at estrogen metabolism. We're going to be looking at foods and exercise and botanical medicines and how you can create optimal breast health each and every day. So I really want you to listen to this next lecture and start practicing the things that you're going to be learning there. You know, 250,000 women will be diagnosed with breast cancer each year, and about 50,000 women will die from it. So early detection is of utmost importance. We're going to be talking about testing our breasts, evaluating our breasts, and what we can do to do our best job in creating healthy breast tissue. And I just really like this picture. I just thought it was so beautiful, and as I was putting together this slide presentation, I just had to include it. Odds of having breast cancer are pretty daunting according to statistics. As you can see, from age 30 to 40, it's 1 out of 252. And all the way up to age 70 to 80, it's 1 out of 8. You know, you do see that our biggest risk for breast cancer is our age. As you can see from Frances that you met earlier, you know, our aging doesn't have to be at a rapid and accelerated rate. And I think we're seeing people actually aging much faster than they really need to be aging. Okay, so we all know about risk factors for breast cancer. We know about family history. There's a personal history of breast cancer. If you've had radiation treatment to your chest, earlier in your life, if you've had an early menarche, which is your first period, or a late menopause, if you haven't had any full-time pregnancies, or if your full-term pregnancy was after age 30, being on HRT for more than 5 years, that's the current thought, not to be on HRT more than 5 years. If you're on a chronically saturated fat diet, high-fat diet, probably void of the omega-3 fats that are breast protective and very high in the saturated fats that create more inflammation in the body. Remember, we talked about an anti-inflammatory diet. Well, a pro-inflammatory diet is really everything you shouldn't eat. So it's all the Twinkies, it's all the candies, it's all the ice cream, it's the saturated fats, it's the fried foods, you know, it's the deep fried foods. And you know, some people, you know, they think that certain foods are healthy, but they're actually not. So like taking your tofu and deep frying it, not a great idea, you know? I had some friends who I think of as very health conscious, and one day they were out in their front yard and they were going to deep fry a turkey. And I was like, what are you doing? You are deep frying a turkey? They said, oh, but it just tastes so good. I'm like, yeah, but think about what you're doing. And so they had a vat of oil, and they were literally, have you seen these? Are you serious? I thought, what are they going to think of next? You know? Okay, so that all leads to obesity. Obesity is the result of many bad choices over many years, okay? It's not something that happens overnight, thank goodness. Regular alcohol consumption is also a high risk factor. We know that women who took hormone replacement therapy and then drank alcohol, actually these women were on Premarin, then they drank a pretty hefty dose of alcohol, that their estrogen levels were high for up to 5 hours post-ingestion. In fact, they were 300 times higher than they were prior to drinking that alcohol. Okay, so what does that tell you? A lot of estrogen, right? Probably all the liver detoxification systems that are normally used to deal with the estrogen were all being used up by trying to detoxify alcohol, which is a toxic substance to your body and to every cell in your body, by the way. Okay? And DES exposure is a new one on the list for risk factors for breast cancer. I have a patient who is a DES daughter, they're called, and she has just recently had to have a hysterectomy due to some very unusual looking cells that showed up on her cervix. Oh, current use of oral birth control pills. Current use of oral birth control pills does seem to be associated with increased risk. However, past use doesn't. Now, I wonder about that because breast cancer has also been associated with estrogen stimulation in women in puberty. And it seems as if breast cancer may result from estrogen insults or insults to the DNA that occur during rapid cell development, which means during periods of time such as puberty. Okay, so if you're going to be putting a 9-year-old who's having periods on birth control pills so you can regulate her period, what does that mean in 20 years' time? We don't know, right? There are a lot of things we don't know, and we're assuming that it's safe, but we don't know if it's safe. And I do have 9-year-old patients who are on birth control pills. I have an 8-year-old patient who started having her period. I believe that these estrogen mimickers, these pesticides, and these estrogen mimickers are stimulating and turning on these estrogen-sensitive cells at a really young age. So these cells, what happens is that estrogen binds onto a cell receptor, affects the DNA, then you get DNA to RNA to DNA to RNA, okay? You get cell proliferation. Cause is estrogen-sensitive tissues to grow. What are those tissues? Breasts and uterine tissue, or the endometrium inside the uterus. When those estrogen-sensitive tissues grow, then they manifest menses, early menses, okay? So typically we get cyclical variations, remember in our menstrual cycle, of estrogen and progesterone, and we get, ovulation and that happening. But in these little girls, what's happening is they get their period and it comes on like a freight train. I mean, this one little girl was bleeding for 3 straight weeks. Now, could you imagine going to the emergency room and you're 8 years old and what they're going to, you know what they're going to do, right? Not a good situation. So, I mean, she can't even deal with it. She can't even comprehend what's going on. So, the fact that I have these patients in my practice, and my practice isn't that big, right? I don't see 20 patients a day. I've only been in practice 13 years, and I see these young girls, and they're having periods, and they're getting breast development much younger than you'd expect. Okay, it's getting younger and younger and younger. Okay. And then finally, antibiotic use. This is a very interesting study that came out, published in JAMA in 2004, for women who did take antibiotics for 1 to 50 days and up to 500 to 1,000 days had even higher risk of breast cancer. I think that it may not be that antibiotics themselves are causing the breast cancer, but it may be that the antibiotics disrupt the bowel flora so much, we know that it destroys the good friendly bacteria, that women are no longer escorting that estrogen with their fiber out as readily, because if you cause a disruption of the bowel flora and you end up with an overgrowth of unfriendly bacteria in your gut, you can literally cleave estrogen from the bile salts that it's coupled with after it went through the liver, and it'll get reabsorbed. So it may be that that is part of what's going on with this, okay? Because remember, estrogen hits target tissue, goes to the liver, gets broken down, gets dumped into the gallbladder, gets coupled with bile salts, gets dumped into the small intestine, goes to the small intestine, and then whoop, it's supposed to go on out through the colon, right? If you have abnormal bacteria in the colon that cleave that estrogen from the bile salts, you could reabsorb it. And I've seen that in women with a lot of candida, a lot of imbalanced flora, irritable bowel, okay? They've got a lot of bad bugs in there. So I thought this was interesting because I wanted to bring up that point, that it probably is due to an effect on the bowel ecology. Breast screening, what's best? Self-breast exam, I know there's research out there saying don't do it, it just scares women, but I really want my patients to be empowered. I think that we need to do self-breast exam. I think it's an important part of being in touch with our own bodies and taking care of our bodies. If you are a menstruating woman, it's best to do it right after your period because that's when you have the least amount of hormonal stimulation. I mean right after your period starts, like within the first 2 days, because estrogen levels are low during your period and then they start to go up towards the latter half. If you are not menopausal, if you are not menstruating but you're menopausal, then go ahead and do the self-breast exam on the first day of every month, okay? This I thought was an interesting fact. I just wanted to put it out here. There may be a urine test for breast cancer risk, but it's not available yet. So it could help predict atypical hyperplasia, atypical cells, or lobular carcinoma in situ, which is an early stage 0 kind of cancer. But that's just not available yet, but kind of stay tuned, okay? Digital mammography, very important. Mammography is an x-ray of your breast, and digital is just much higher powered, and it's much more accurate. Ultrasound is going to be done if you have a lump in your breast, and I highly recommend you get an ultrasound if there's anything suspicious that shows up on your mammogram. And then, is there any place for thermography? People who promote thermography, they say that it can detect a breast cancer 8 to 10 years prior to an actual manifestation of breast cancer, right? So that would make you think that it could also find it if you had a breast cancer, right? Okay. So a patient came to see me, nice woman who had had an abnormal mammogram. She then went and had a thermography, and the abnormal mammogram was like, well, you know, you really should, you know, get a biopsy. She decided to have a thermogram done just to see if there was anything abnormal. She went and had that done, and it said, oh, everything looks perfect, it's just fine. She then came to see me, and I was like, well, you know, you don't know till you know. And that's the bottom line, you don't know till you know. So I encouraged her to get a biopsy, and I'm really glad I did, because she had breast cancer. And she had carcinoma in situ, stage 0, so early stage. If you catch an early stage breast cancer, a carcinoma in situ, almost like a precancer, okay, you get to live. You get to live a long life. You get to have an excisional biopsy. Yay! You don't have to go through radiation. You don't have to go through chemotherapy. And you have a 96.3% of surviving 5 years. That's a really great thing, isn't it? Okay, so do we want to go and rely on thermography to assess whether our abnormal mammogram is telling us that we should do something or not? No, it's a waste of your money, quite frankly. One of the things that it may do is it may assess for estrogen dominance in the breast tissue, but quite frankly, why are you just looking in the breast tissue? Let's look at the whole body. But you know, I will tell you honestly, breast cancer is an epidemic. It's an epidemic. I have a 32-year-old patient just recently diagnosed with breast cancer who just had to have a mastectomy. And she wants to have another child, so before she goes and has reconstruction, she's going to have her baby and then go through reconstruction. Okay? I have a patient who's 27 years old who had bilateral breast cancer. Okay? And some of you know, I mean, I have a lot of patients who have had breast cancer. And luckily, most of these breast cancers are caught very early. Okay, and they're caught in that either ductal carcinoma in situ or they're stage 1. And you know, there's different stages and grades, and I don't want to get into all those details, but we really want to find breast cancer before it goes into your lymph nodes, because it's kind of like we have little rivulets that move then into little rivers, that move into bigger rivers, that then move into the ocean. Well, that's what's happening with our lymphatic system in our breast tissue. Here's the correct type of breast self-exam, okay? So we're going to bring our arm up. We're going to start in the armpit. We're going to move down and across and down and across. That way we cover all the breast tissue, okay? That is actually considered the most accurate method of doing a self-breast exam. We want to use this part of our fingers, okay? We don't want to be using the tips of our fingers. I've seen people do that, like, okay, you know, but we really want to train our fingers. If we can teach people to read Braille, we can teach ourselves to read our breast tissue. We know our breast tissue. Our doctor feels our breast tissue once a year, right? Once every few years, maybe even? Okay. We need to feel our own breast tissue. I can't tell you how many of my patients actually find their own breast cancer. Okay, my mother found her own breast cancer too. Now, she had a mammogram in February, and she found a lump in July. Okay, so the mammogram did not pick it up. So mammograms are not 100% accurate. In fact, Susan Love says that they're only accurate 30% of the time, which is pretty scary. Maybe digital mammography is increasing that percentage number. And you know what was interesting? In my research, I could not find the stat on that. Okay, breast cancer locations, as you can see, the upper outer quadrant, 50% of cancers are found there, 15 in the inner quadrant, lower quadrant, 11 below the upper, so the lower outer and then the inner quadrant. Breast anatomy with tumor. See all those lymph nodes in there? All these lymph nodes here in green, sentinel lymph node, tumor. This is what they're going to be testing for if they do find a tumor. I do have a breast model here. It's a silicone breast model, and it does have breast tumors in it that you can feel. A lot of people are like, well, what am I looking for? What you're looking for is a hard, non-movable lump in the breast, okay? But any lump, regardless of size, shape, should always be evaluated, okay? You don't have to have a lump to have breast cancer. There is a form of breast cancer called inflammatory breast cancer that looks like, you know what an orange looks like? The skin of an orange, it kind of has that pockmarked look. That's what it can look like. And if you have swelling in your breast, inflammation, it could be a sign of inflammatory breast cancer. Very important to tell your girlfriends if they have any kind of breast inflammation to have that checked, not to have it treated as a mastitis, okay? Any nipple discharge from the breast needs to be evaluated. That 32-year-old patient that I just mentioned, she had finished lactating about 6 months ago, and then she kind of squeezed her nipple, and a little bit of fluid came out, but along with some blood. And she went to her gynecologist, and the gynecologist said, oh, it's nothing, and you had squeezed it. You know, it didn't come out by itself. Well, she just wasn't comfortable with that, and it kind of kept happening, and she kept checking it. So she went to get an evaluation, and sure enough, she had breast cancer. Okay, so any bloody discharge from the breast, you want to make sure that you check that. So inflammatory breast tissue and breast cancer, any breast tissue that's red, swollen, may feel warm. Again, that pitted appearance, and red flag, you don't have to have a lump to have breast cancer. Inflammatory breast cancer symptoms, pretty straightforward. Flattening or retraction of the nipple, that could also be a non-inflammatory breast cancer symptom. Dimpling of the breast, a feverish breast, swelling of the lymph nodes in the affected side, pain or soreness in the breast, lump or thickening of the breast, persistent itching of a breast or nipple, redness, blotchiness, or rash on the breast, which I think some women have just let go undetected. You know, they didn't go and do any kind of follow-up exam, and then at that time it had already spread. In fact, it's a very aggressive form of breast cancer, so it needs to be evaluated right away. And a rapid and unusual increase in breast side on one side. So what can we do to have healthy breasts? And this is like really what I'm all about. We want to definitely get our regular mammograms until we have a better form of evaluating our breast tissue. We want to do our foundation of health, right? It's all there, our foods, our exercise. We want to buy organic food. We want to decrease our exposure to estrogen also in the personal care products that we use. Try to buy organic or natural soaps and cleansers. You know, makeup is kind of tough. It's a tough one. It's really hard to find good quality makeup. I have bought makeup through Dr. Hauschka. You can buy it at Down to Earth, okay? You want to be sure that you detoxify from estrogen well, and you want to keep your liver and spleen healthy. The liver, the breast tissue and the uterine tissue are considered extensions of the liver in Chinese medicine. This is why we want to make sure we keep that liver qi moving, because when liver qi gets stuck, we not only get frustrated, but we can form lumps in our breasts and fibroids in our ovaries. Foods that are detrimental to breast health, I think we can figure that out. It's pretty straightforward, yeah? Saturated animal fats, omega-6 fats in excess. This is our corn oil, safflower, sunflower oil, soy oil. Too much is not good. It creates too much inflammation. There are 6 double bonds in those fats, okay? Do not ever, ever, ever fry with omega-6 fats. Safflower, sunflower, corn, soy oil. I mean, how many of us took soy margarine and fried? Not only were we getting hydrogenated oils, which means that they took these beautiful, long, 6 double bond fats and they put them under heat, pressure, and light and then bent them so that they'd stay stable at room temperature. These are highly dangerous fats. They're bad for your heart, they're bad, they're pro-inflammatory, they could be pro-carcinogenic. Now, grapeseed oil is an omega-6 fat that is an exception, and it actually can withstand high temperatures much better than the other omega-6 fats. Like, there's no exact rules, you know, I mean, there's a basic rule of cook more with monounsaturated and maybe coconut oil. But then there's always something that's going to, you know, twist you up. There's always something in there that's going to twist you up in something. But it's like this grapeseed oil. It's an omega-6 fat, but you can cook with it. We all know about refined sugar, non-organic food. We're going to get a lot of estrogen mimickers in that food. And then the barbecued, fried, broiled meats are going to give us a lot of heterocyclic amines. Once in a while is fine. We just don't want to be doing it every day. Okay, so DIM we've talked about from our cruciferous vegetables. Calcium D-glucarate helps prevent the cleavage of estrogen in the intestines by that bacteria. Folic acid helps with DNA cell turnover, so make sure that you're going from DNA to RNA in a good way. Omega-3 fats we've talked about. Iodine we've talked about. See how these things all interrelate? Okay. Medicinal mushrooms, this is where our reishi mushroom comes in, which we talked about earlier. Our Chinese herbs to help keep the flow of the qi and blood through the breast tissue. Sulforaphane is in our broccoli sprouts, which are all going to be growing, right? Coenzyme Q10 it helps with the production of energy inside cells. Curcumin is from turmeric. Curcumin is a very potent anti-inflammatory. I use it with my arthritic patients. I also use it in my breast cancer patients, although there's only so many things that you can give somebody. So what I really think we should do is have more turmeric in our diets, okay? Turmeric is going to be found in our curries. The green tea, also very important as we talked about. Melatonin. Now, melatonin, my mother went to that clinic in Mexico. She was actually taking 50 milligrams of melatonin every night. That's a lot. Melatonin is suppressive of estrogen. Okay? Although her breast cancer was not estrogen receptive positive, it can still play a role in the proliferation of breast tissue cells. Okay? The typical dose for melatonin would be 1 to 3 milligrams. Now, she's not doing that anymore, and she's still doing very, very well. Vitamin C, D, and selenium, also very important. Vitamin D. Now, vitamin D isn't thought about that much in terms of breast health, but it's very important in cell differentiation. That means that when you have a cell go from DNA to RNA to DNA, it has to look like its cell that it came from, okay? A cell that's well differentiated means it looks more like a human cell. A cell that is undifferentiated looks more like a bacteria, okay? Vitamin D helps make sure that the cells are well differentiated, okay? Does that make sense? Vitamin D is very important not only in breast health, but also in colon health and obviously in bone health. That's where we mostly hear about it. And then finally, we have our self-breast massage. Now, I have a description of this in the book, and this is something that Jennifer Telford does do in her massage practice. She is specialized in self-breast massage, and I think you've got some pamphlets on that here too, and a brochure, yeah. Now, what I'd like to do now is if, Jen, you could come up, and I'd like to show you how to do this self-breast exam, but she's not going to take her shirt off. Why don't you come on up here? Hi. Okay, so if you can go ahead and bring your arm up over your head like this. So when you're laying in bed, and I think this is the best place to do it, you don't want to do it in the shower because it's too distracting, but you can if you want to. And then I would use some of this breast caress on your hands, and my hands are freezing. Are you sure? Okay, you want to start in this part of the breast. You want to make sure that you get the lymph nodes all through this area here, okay? So you want to look at do your whole armpit, and then you want to come down the breast. Now, I use a crawling motion. I don't do this action. You can do this action, but I find that when you use a lotion, you can just feel so much more with the pads of your fingers if you kind of slide and move them, because you're trying to feel a slippery lump, okay? Not something that you press down and you feel like that. So you really want to develop a good technique on yourself. And then we're just going to come down like this, And then we're going to come straight up the breast tissue like that. And you want to come right up to your collarbone. You actually want to feel right in here into the collarbone. Come straight down the nipple and come straight up. Now, one thing that this technique does not show you is that you really need to also squeeze the nipple at the end, and you want to look for any kind of discharge, and you want to press straight down on the nipple to see if there's any lumps beneath it. My fibroadenomas are right below my nipple. So, I mean, you wouldn't find it otherwise. Yeah? I also recommend you want to bring this hand down and bring it underneath like that, and then you can bring this hand here. I also recommend that you use this hand here to support the tissue, and then you can crawl down this way.
Coming down.
Yeah, excellent. Okay, you see that? Because then you have something to kind of press against. It's not just your chest wall. Okay, and then you can also do it this way as well. You can do it that way and go this way.
Or bring it this way.
Yep, you can do either way. So when I'm in the office with a patient, I always use this as a leverage, and especially if you have more, if you have larger breasts and there's more tissue, you want to be able to anchor and then move across so that you can feel. If you're a thinner person, you want to make sure you know the difference between breast tissue and rib. I've had a number of patients come in and go, oh, I have a breast lump. It's really hard. and it's their rib, okay? So we definitely want to do that. Thank you.
You're welcome.
Okay.
Thank you.
Okay. Very good. And we want to do the same thing on the other side.